Love is a beautiful thing unless you have an intense fear of falling in love. An intense fear of falling in love is called philophobia. And like other phobias, it follows the same path. It is not in the DSM-5, so you can't get an accurate diagnosis of it, but it does fall into some of the other phobias. It looks like them, like the social phobias, but it is a particular area of being afraid of falling in love. Now, the first thing I want to go through are the symptoms. So you may be dating someone who struggles with this, and they're going to call it more a fear of commitment more than likely. They call it because then they don't have to go into detail, and because many times they lack self-awareness of the intensity of it until it's reacting, until they're in a relationship that it's actually alive, then they oftentimes won't deal with it. So the signs are feeling intense fear or panic, may even go into a panic attack, avoidance, sweating, a rapid heart rate, difficulty breathing, difficulty functioning, and a nausea. People who struggle with this, it's every bit as intense as a social anxiety. If you're out with other people and all of a sudden you get one of these, you feel like you're losing it. You feel out of control. And the thing that you have to remember is, although it's not a social anxiety disorder, they do go through the same kinds of feelings, and social anxiety disorders can also suffer with philophobia. I think what's really important to understand is, what can they do to treat it? Since it's not an accurate diagnosis, like it's not a real diagnosis, it can be difficult to do that. But you want to remember that you can get therapy for it. It's the same thing like if you're getting phobia therapy where they use desensitization and things like that, those can be helpful forms of treatment for it. But more than that, you can get not only talk therapy, cognitive talk therapy, cognitive behavioral therapy. You can also change your lifestyle. We know that when we put these people on a program where they're actually working out, maybe doing yoga consistently every day, breathing exercises, like all phobias, you give them ways to calm down their anxiety when they have it. Things like something cold against you, putting your head in an the ice box, opening the freezer and just breathing in can help calm it. Because remember, you're going to build walls around yourself if you don't deal with this. So you don't want to live with this kind of thing. You do want to make changes. And medication can help. Although medication is not the only answer, it will help. When I do therapy with philophobias, the most helpful thing I found is if I can help them plan. So if you can plan something, you can feel in control of it. So questions to ask yourself as a form of planning so that you can work through this on your own. Maybe you don't have money for a therapist. Maybe you don't know who to go see. You can deal with this like any phobia on your own if you'll only practice some of the lifestyle changes and ask yourself these questions. What if a relationship doesn't work out? Remember, this is a phobia triggers something from your past that scared you to death. And so what you do is you avoid the fear. You avoid thinking about the fear by avoiding ever repeating it in the future. And that happens whether you have an elevator phobia or a social phobia. You have to identify what would happen if the worst fear happened. So what would happen if you fell in love, just totally in love? What would happen? And when you start going through the plan, well, I'd feel terrible, I'd feel vulnerable. Yeah, but, and you keep saying but, and you write it down. But what about that? Would you still be alive? When you realize this isn't going to kill you, it really helps you start softening toward coming toward it. And that way you can allow yourself to love again. Ask yourself what happens next. Like always, if I kiss this person, what happens next? Maybe they'll want more from me. What would I feel? Would it kill me? Would I survive it? Yes, you would. Am I still okay? if you ask yourself these questions, like after each time you go out with this person, am I still alive? Am I still okay? Yes. So being closer to this person and allowing myself to be vulnerable doesn't kill me. It's a process. And it helps if the person that you're with understands what you have going on so they can walk with you and they'll go slow with you. When I think of those tips, other tips of how to support someone with philophobia, these are the things that I have found helpful for my clients. Recognize that it's a serious fear. And even if you have trouble understanding it, doesn't mean that it's not real. So be with them and understand they are really shaken by this. Educate yourself about phobias. All phobias follow a pattern. You avoid the stimulus, and in this case, it's falling in love. Don't pressure them to do things when they're not ready. When you pressure someone, you start something in their brain that they become afraid of you. Their phobia generalizes now to you. And so now you've got a real problem because not only are they afraid of falling in love with you, but they become afraid or fearful of you. Encourage them to seek help if it seems appropriate and offer that you will go with them if that seems good to them. I think therapy can really be a great way to buffer some of the fear and also help guide the plan so that the person feels like they have some control and some consistency, boundaries. You feel out of control when you have a phobia, so gaining control is always an important element of solving it. And lastly, ask them what you can do best to support them. Nobody has to live forever with philophobia and miss the incredible awe of falling in love. So if you have it, know you can get through it. Start practicing the behaviors I've aligned here. And if you love someone who is able to tell you about this fear, be supportive. Don't make fun of them. Take it seriously and be part of their treatment team.